So this is the urinary system cram session. This is an overview of the major concepts of the urinary system in your fundamentals book. So let's get started. Care of the patient with an ileal conduit is a nursing challenge because of the continuous drainage of urine through the stoma. So you want to check skin integrity. Kidney transplantation. The non-functioning kidney is typically not removed. You want to assess for signs of rejection and infection. There are community support groups sponsored by the American Association of Kidney Patients, which helps the patient and family adapt to living with dialysis and transplantation. Clinical manifestations of chronic renal failure. So you'll see disorientation, headache, lethargy, asthenia, anorexia, pruritus, anuria, and muscle cramps. There are 3 phases of acute renal failure, which is oliguric, diuretic, and recovery. So in the first stage, your blood and creatinine levels will be increased. The second stage, your blood chemistry begins to return to normal. And the recovery phase usually takes up to 1 year. Acute glomerular nephritis. It's caused by beta hemolytic streptococci infections. You'll see swelling of the face, especially around the eyes. Your assessment: anorexia, nocturia, malice, flake pain, and exertional dyspnea. Hematuria with changes in urine color from cola to frankly sanguineous. And the diet is protein restrictions and carbs for energy and fat. The Nephrotic Syndrome. It is a disorder characterized by marked proteinuria, hyperlipidemia, hypoalbuminemia, and edema. The patient has anasarca, which is generalized edema. The urine is foamy. Their diet is low sodium, high protein, and their nursing intervention is to maintain some bed rest. Semen Analysis. It is often the first test performed on the male when evaluating fertility, so they're considered infertile if they have less than 20 million sperm. Testicular biopsy. It's used to detect abnormal cells and the presence of sperm. Prostatic smears. It's done by massage to detect and identify microorganisms and tumor cells. Male cystoscopy is the prostate and the bladder can be seen. Kegel exercise. You want to hold for 5 seconds, then release, and repeat at least 10 times. Male climacteric. It is less pronounced and occurs between 55 and 70 years old. The body doesn't put out enough testosterone levels and seminal fluid production. The impact is largely psychological. An erection requires more time. They have loss or thinning of hair. They interpret decreased sexual needs as a loss of productivity and sexual power. So your nursing interventions would be to encourage them to verbalize their fears. Erectile dysfunction. The man's inability to maintain or attain an erection. It can be psychological, organic, surgical, from low testosterone levels, hypertension, or substance abuse. So in younger men, it may result from substance abuse. Your medical management is to review their history. You can give medicines such as Cialis or Viagra, and you give 50 milligrams 1 hour before sexual activity, and it's not used for patients with uncontrolled hypertension, heart problems, or patients taking nitroglycerin. And your patient teaching is for them to monitor for signs and symptoms of infection and fever, dysuria, or UTI. Men should have a yearly PSA and digital rectal exam starting at age 50 or 45 for African Americans, and the PSA level should be less than 4. To determine the urinary output, subtract the amount of irrigation fluid from the Foley catheter. Check catheter drainage tubes frequently for kinks that would occlude urine flow and cause bladder spasms. The patient who has a TURP may have continuous closed bladder irrigation or intermittent irrigation to prevent occlusion of the catheter with blood clots, which could cause bladder spasms. Inform the patient that hematuria is expected after prostatic surgery. Suprapubic prostatectomy is accomplished by an incision through the abdomen. Take care to avoid decompression of the bladder to prevent rupture of mucosal blood vessels. Usually no more than 1,000 milliliters of urine should be removed from a distended bladder initially. Oliguria, decreased urine output. The primary sign of bladder cancer is painless intermittent hematuria. Risk factors for renal tumors: history of dialysis, family history, hypertension, horseshoe kidney, polycystic kidney disease, and smoking as one of your major factors. All urine is strained. Any stones or gravel noted must be sent to the laboratory for analysis. So this is going to happen with your patients with kidney stones. Lithotripsy is the crushing of a stone. Uroliphasis. Your subjective data include patient with mobile calculi complaining of intractable pain, which is pain that is unrelieved by ordinary medical measures and is usually accompanied by nausea and vomiting. Azotemia. This is the retention of excessive amounts of nitrogenous compounds in the blood. Acute pyelonephritis may be unilateral or bilateral, causing chills, fever, prostration, which is extreme weakness, and flank pain. Warn the patient with acute prostatitis to avoid sexual arousal and intercourse so that the prostate can heal. Prostatodynia. This is pain in the prostate gland. It manifests with neither inflammation nor infection, but demonstrates the other symptoms typical of prostatitis. Cystitis is most common in women because of a shorter urethra. You want to do a clean catch or catheterized urinalysis with culture and sensitivity tests. Asthenia. This is a general feeling of tiredness and listlessness. Urinary incontinence. You want to avoid alcohol, caffeine, and spicy foods, which may irritate the bladder. The pessary is a device that can be inserted into the vagina to support the bladder and to reduce pressure of the bladder from the uterus in cases of prolapse. A patient with stress incontinence can learn to control leakage by performing Kegel exercises. To stimulate urination, you can turn on the water. You can place patient hands in warm water, and you can pour water over the peritoneum. Residual urine. This is the amount of urine left in the bladder after urination, and it should be less than 50 milliliters. Diuretics. Monitor for patients taking digoxin for toxicity. The use of most diuretics require adding daily potassium sources, such as baked potatoes, raw bananas, apricots, or navel oranges. Aldactone. It blocks aldosterone in the distal tubule to promote potassium uptake in exchange for sodium secretion. Chlorothiazide. It's contraindicated in anuria, which is a urinary output of less than 100 milliliters in 24 hours. Thiazide diuretics. They can cause hypokalemia. Pyridium. It is your urinary analgesic, and the urine may turn a reddish-orange color. Urinary incontinence can lead to a loss of self-esteem and result in decreased participation in social activities. By age 70, the filtering mechanism is only 50%. The posterior pituitary gland releases ADH, and ADH causes the cells of the distal convoluted tubules to increase their rate of water reabsorption. Filtration of water and blood products occurs in the glomerulus of Bowman's capsule. The kidneys lie behind the parietoperitoneum, which is called the retroperitoneal. As proteins break down nitrogenous waste, which is urea, ammonia, and creatinine, is produced. So that's it. That is the overview of your fundamentals urinary system. Make sure that you like, subscribe, and leave a comment. If you subscribe, you can get notified when the next videos are uploaded. And thank you for watching.